Alessandra Menezes. I'm currently based in Guatemala, working as a head of program, but previously I was the project manager of the Amedix project, of which we are going to talk about now. In Guatemala, in the public healthcare system struggles to keep with the demands of an aging and ever-growing population, and limited resources, high medical costs, poor infrastructure, and high levels of perceived corruption in the public sector. Some add up to further challenge the system. The purchase of medicines corresponds to 1.7% of the GDP, and of the total purchase of medicines by the government, 73% are made by the Guatemala Social Security Institute. But historically, Guatemala Social Security Institute has presented great institutional weakness and inefficiency in managing its supply chain of medicines and among other health services. In mid-2015, a high-level corruption case involving Guatemala Social Security Institute was brought under the spotlight, and investigations led to the arrest of 17 individuals, including the Social Security Institute's president. So, as the first outcome of Amedix project, UNOPS carried out a comprehensive diagnostic of the Social Security medicine supply chain, applying the Procurement Efficiency Assessment Tool, the PAT, and developed a short, medium, and long-term action plan to break with market conjuncture that limited the Social Security's own autonomy and to introduce the necessary modifications outside and within the entity to ensure greater efficiency, transparency, and effectiveness in spending. When you have to implement institutional changes, in this case, we needed to foster the need to introduce a system-wide culture that rejected corruption. But entrenched corruption is not easy to eradicate, and UNOPS faced significant challenges from inside and outside our partner. Because long-term suppliers and even some partners' employees who had profited from previous poor processes carried out by the Social Security, they resisted our attempts to reduce costs. Then legal claims and protests were launched against the reforms that we are proposing, and even false stories attacking the project in the media, leading to an adverse coverage and undermining the merits of the project. So in response to that, we had to take a series of actions to support and defend the implementation of the project. On one side, a team of local experts in communication and international law was formed to monitor the situation in the country and anticipate threats to the project. And in parallel, we had to establish a sort of coalition of concerned, as we used to say, with opinion makers, with thinking tanks, with the media, with entities representing the private sector and the civil society, all actors with strong influence in the country's context to help us defend the implementation of the project. Amedix was a $500 million project in which we contributed to the expansion of access to medicines, supplies, and medical treatments. We helped consolidate the Social Security Institute as an influential buyer position. In the end, Amedix project has proven that it's possible to establish a purchasing function with adequate planning and stock management, transparency, competitiveness, good value for money, supplier diversification, and the institutionalization of quality assurance mechanisms, contributing to achieve the Social Security vision of improving the level of the healthcare service provided to its beneficiaries. The biggest lesson we have learned here is that it is possible to do things in a different way. And UNOPS can go beyond transactional support and have a strategic role in promoting structural changes that can lead to sustained transformations, not only within the partner, but in an entire supply chain, either locally or regionally or globally. But to do this, our policies, systems, procedures, and especially our mindset needs to be flexible and adaptable to the scale of those challenges. UNOPS had a previous engagement with the Guatemalan Social Security in which we successfully helped them to implement their master plan for health infrastructure development by building and equipping several hospitals and medical units across the country. So they saw on us a trustful partner to this challenging project.